Hi, my name is Nurse Sue. It looks like we have a new admission in the emergency center. Let's go take a look. We have 4-year-old male patient Haru N. He is admitted with a temperature of 102 degrees, a heart rate of 130, a rash on his extremities, and edema of the hands and feet. He is crying and inconsolable. His mother informs us that he has had a fever for the past 5 days. She took him to the clinic and was instructed to give acetaminophen, but it did not help, and the fever has gotten worse. Upon further assessment, we find that Haru has reddened eyes, swollen cervical lymph nodes, and a strawberry tongue. Dr. Francis suspects Kawasaki disease. This is a rare, acute, systemic condition that results in inflamed blood vessels. He urges treatment because Kawasaki disease can lead to coronary artery abnormalities. He orders the following: 2 grams per kilogram of IV immunoglobulin, 100 milligrams per kilogram per day of aspirin, and a transthoracic echocardiography to check for abnormalities. Haru's echo comes back normal. Haru has hyperthermia related to an inflammatory disease process as evidenced by a persistent high-grade fever. I make sure to monitor his temperature every 2 hours, administer his antipyretic medication as ordered, and encourage adequate fluid intake. He is also at risk for impaired skin integrity related to peripheral erythema, as evidenced by a generalized rash. To control this, I will assess the skin for breakdown and signs of infection every 2 hours, apply emollients to the skin, and supply meals with adequate protein. 3 days later, Haru is free of fever and ready for discharge. He will remain on a low-dose aspirin therapy, and the condition should resolve within 8 weeks. He is scheduled for a follow-up.